I'm Dr. Glenn Gutierrez from the TEDx in Beacon Street 2019, and I'm here to present to you Dr. David D'Alessandro, cardiac surgeon from the
Massachusetts
General Hospital. And first question I have for you, David. You mentioned some stories about other surgeons. I was curious if you had any personal stories about yourself in terms of either successes, most rewarding case, or not so rewarding.
Yeah. I think, one of the things I do is transplant surgery.
Okay.
And what I like about transplant surgery is it gives you a longitudinal connection to a patient. Most of what we do is valve surgery or bypass surgery. You meet a patient in the office, you do a surgery, and they're gone. You might get a card, at Christmas time or something like that, but you kind of lose your connection. The transplant patients come back year after year after year, and you see them. And not only that, they often have had several operations, often done by me, before they get their transplant. So they're people that I'm very invested in, not just them, but their families. And that's what I really like about transplant surgery, is it kind of maintains that connection to the patients.
Well, that's beautiful. Absolutely beautiful. And I understand you have some work with heart failure and external and internal cardiac pumps.
Yes.
Can you describe a little bit more about the pumps and their...
Sure. So heart pumps have come a long way. It's kind of been this, heart transplant remains the gold standard as far as therapy for end-stage heart failure. It's the best treatment we have. But pumps are kind of inching closer and closer and closer. And we move from pulsatile systems, and the problem with pulsatile systems is durability. There's too many moving parts, too many valves, that sort of thing. When you move to non-pulsatile systems, now we have machines with no wearable parts. They're magnetically levitated impellers. They don't wear out. And so other than the external components, these are pumps that could last indefinitely. So the quality of life, the durability, as far as how patients do physically, it's getting closer and closer to transplant. And I think at some point in the next 20 years, they may cross.
They may cross.
Yeah.
That's exciting.
Yeah.
Now, I'm going to go on a little bit more of a different topic. And as a physician myself, there was a time when I was inspired to become one. And I was curious in terms of what inspired you to be a physician or a cardiac surgeon, surgeon, etc.
Yeah. I come from a surgeon family. My grandfather was a surgeon. My dad was a surgeon. One of my aunts was a surgeon. So it almost seemed like I had to be a surgeon. I think that when you grow up with surgeons, you sort of, I think some people gravitate towards that. Some go the other way. My brother went the other way. But I think for me it was always kind of something I strove to do, and I never really wavered too far from it. The choice of cardiac surgery was a choice I made just before medical school. I had the chance to work in the lab of Randy Greep, who is a luminary in our field that was working at Mount Sinai at the time, and had a great physiology lab. And that was just very inspiring for me. So that's how I gravitated towards cardiac surgery. And then where I trained at Columbia had a really good cardiac surgery program, and where you train also influences what you end up doing. So I think that's sort of, you kind of find your path by who influences you. It started out with my dad, and then it was, mentors along the way.
Right.
Yeah.
That was absolutely amazing. Loved it. It was great meeting you. Thank you very much.
Thank you.